We are the Pediatric Palliative Care Special Interest Group. We really came together as a group of people with a common passion and really committed to looking at the highest quality of care and the highest standards of care for children with serious illnesses and their families.
We do have unique challenges. Obviously the patient population is different, the funding is different, the diseases are different. A lot of the challenges are different, and so to have a space where we're all together and thinking about that is really valuable.
Because pediatrics is the minority in palliative care to begin with, the voice gets silenced. People don't think about it, and so part of our role and our goal is to really have that pediatric voice heard.
These are the patients that we can't fix what they have. We can't make it go away, but can't we just make whatever time they have as good as possible, and whatever that family needs, and all the different ways that palliative care supports them. So the physical symptoms, the emotional support, the spiritual support for the child, the parents, the siblings, just to be able to offer that to people. There should be no reason why we can't.
My project is in integrating primary pediatric palliative care education for all disciplines, really to teach them sort of the basic tenets of how do you talk to a family, how do you respond to a family, how do you get them the resources that they need, because the palliative care team in many places is not there 24 hours a day. Receiving the Sojourns Scholars Grant from the Cambia Health Foundation has really been transformative for me personally as a leader. It's really helped me to step out of my comfort zone and to really think more strategically from sort of the 30,000 foot level. For our region, it has lifted our institution and our palliative care program into really something that is known regionally, and I think even becoming known nationally for the work that we're doing.
My Sojourn Scholars Project is looking at how do we maximize the use of this home-based palliative care and hospice programs. We're not always referring the children either to the right program or the right time. And so my project was looking at what's going on with that. How are we identifying the patients? What are the barriers to either identifying the right patients or to making those referrals? We created some clinical decision support tools for those nurses to use that helps guide them through that process. And we've also developed some communication tools for the hospital-based team to talk to the community-based team, because kids go back and forth. They go back, they go back and forth a lot, and so can we do a better job to know on both sides what's going on? Having the Cambia award has been transformative for me as a leader, and I think personally in my own development, just to really take my leadership to the next level, right?
Once you are known as a Cambia Sojourn Scholar, your name sort of gets out there, and then you get these opportunities that you never would have thought you would have ever had before, and that has, again, been something that's been very fulfilling and a way to get, in our case, that pediatric voice out there and nationally get the issues that we really want to have known and talked about. So just being known as a Cambia Sojourn Scholar has been a wonderful experience.